I've said all along that if the positivity rate or the hospitalization rate increase too much, we have strategies to reduce the spread of COVID-19 without having to return to stay-at-home policies. Closing down Texas again will always be the last option. I want to review several key data points. First is a graph showing the daily number of people testing positive. In the last half of May, Texas averaged about 1,500 positive cases a day. In the past 5 days in June, we've averaged more than 3,500 cases a day. Second is a graph showing the rise in the positivity rate. The positivity rate has gone from about 4.5% in late May to almost 9% today. Last is a graph showing the rise in hospitalizations. Hospitalizations for COVID-19 averaged just over 1,600 a day in the latter part of May. In the last 4 or 5 days, hospitalizations have averaged more than 3,200 a day. To state the obvious, COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled. We have several strategies to reduce the spread without having to shut Texas back down. First, we need to have all Texans follow the safe protocols that we've all come to learn. Stay at home if you can, sanitize your hands, try to stay 6 feet away from others that you're not traveling with, and if you cannot stay a safe distance, wear a face mask or a face covering. Second, appropriate authorities are increasing enforcement. For example, TABC is shutting down overcrowded bars that are not in compliance. Counties are closing things like river park operations that have grown too crowded. Some authorities are requiring masks in congregated areas. Third, we are surging testing in areas that may be hotspots. We are working with the CDC on this effort. Also working with us on this effort, as well as the entirety of our strategies in responding to COVID-19, are citizens from Texas who are serving in the Texas National Guard. About 3,500 of them remain in active duty service across the state of Texas, helping our state respond to the spread of COVID-19, and I thank them for their service. Fourth, we're working with hospitals to ensure that they have the ability to treat anyone who tests positive from COVID-19. And fifth, I know that some people feel that wearing a mask is inconvenient or that it is like an infringement of freedom. But I also know that wearing a mask will help us to keep Texas open, because not taking action to slow the spread will cause COVID to spread even worse, risking people's lives and ultimately leading to the closure of more businesses. About how you can get involved to help slow the spread of COVID-19, and you can do that online by going to open.texas.gov. Our goal is to keep Texans out of hospitals and to reduce the number of Texans who test positive. COVID hasn't suddenly gone away, but neither has our ability to slow the spread of it. Texans have already shown that we don't have to choose between jobs and health. We can have both. We can protect Texans' lives while also restoring their livelihoods. Together, we can keep Texans safe. Together, we will keep Texas wide open for business.